Welcome to Living the Green, where cannabis science meets real talk, real stories, and let's be honest, some pretty high vibes. Meet your hosts, Abir, a nurse practitioner and cannabis expert blending science with soul, and Michal, a psychotherapist, truth teller, and mental health maverick. Together, they break it down, challenge what you think you know while keeping it real. So grab your joint, your curiosity, or just an open mind, and let's get elevated. Welcome, everyone, to our first episode of our podcast, Living the Green. And Living the Green, we wanted to call it Living the Green because it's a podcast about cannabis and everything in between. Cannabis health, women in cannabis, men in cannabis, everything cannabis, cannabis politics. Our word, we're both healthcare professionals. We're going to talk more about ourselves in a little bit, but we're both healthcare professionals that are advocates in cannabis, and both of us have experienced the healthcare benefits and just wellness, overall wellness of cannabis. And we want to remove that stigma from behind using cannabis. And we want to tell you that your healthcare providers, please share with us if you use cannabis, because there will be no judgment whatsoever. And that's the whole goal of this whole podcast. But I want to, talking about this, I want to introduce my wonderful co-host, Michal, but I'll let her talk more about herself.
So excited to be here with you, Abby. So excited. So hi, everyone. I'm Michal Cohen. I'm a licensed clinical social worker. Right now, I practice as a psychotherapist and a psychedelic guide. I have my own practice here. And a little bit about me. I got my master's from Columbia University, and I spent a lot of time working with veterans, which is actually what brought me out here to Hawaii. I work for myself now because the VA wasn't always a place where it was safe to be, acknowledged as somebody that uses cannabis. And what I would just like to share about myself is that cannabis has helped me tremendously with my mental health journey. I had a lot of mental health struggles in my 20s and 30s, and cannabis was so helpful to me. So I have a real passion for cannabis and mental health. And I also think it's fun to get high. And I also just want to normalize that.
Amen.
So I'm going to now let my dear, dear friend Abby introduce herself.
Thank you, my dear. That was wonderful. And thank you for putting in such wonderful words. My name is Abir Amirdash, or you can call me Abby. I am a nurse practitioner, acute care and geriatric nurse practitioner, or for Kapuna medicine. I'm also a licensed in cannabis medicine, or I am certified in cannabis medicine as well. And I have my own clinic as well called Pakaloha Care Clinic, where I do medical cannabis certifications and also education and dosing recommendations for anyone who is using cannabis or new to cannabis and need some dosing recommendations, because it is medicine after all. And I'm an advocate for the plant. I'm an advocate for patients, my medical cannabis patients in Hawaii. I am active in the legislative session. I fight for my patients' rights. I do talks to other clinicians, hospices also, educate them about using cannabis with their practice. I just want people to remove the stigma from behind using cannabis, and also remove the stigma, like you said, from getting high. It's okay. It's fucking okay to be high. When you take opioids, you get high. But do you hear, anyone say about, oh, don't get high? No. So it's just, this is the message. Cannabis is medicine, and cannabis can be used as a tool, and it's, so we're here to talk about all of that. And thank you for giving us the time to talk. And I wanted to start, our first episode is actually personal to both of us. Our first episode is about ADHD. We both have ADHD. And I was diagnosed at a later age, but we'll talk about it. But when I started researching ADHD, I kind of went down through a rabbit hole actually, because I was looking for terms. What's ADHD called in different languages or whatever? And one that I encountered that was very beautiful. It was in the Maori language. It's called Aroreretini, and it means the mind who wonders. To many, attention goes to many things. So it's portrayed in such a positive impact. And in other, also like East Asian cultures, the same thing. They took, it was people who had that energy. They used to actually use them as cultivators and healers and stuff, because they said they had that energy that they could be occupied with so many things. It's then versus, Western culture. I was looking at it, it was very descriptive, and it was attention deficit, like negative connotation words to it, or it was like different, just negative connotations. So it was just kind of like eye-opening to me. But just to define what ADHD is a neurodevelopmental disorder, meaning it starts from childhood. Even for people who are diagnosed at a later age, it didn't just happen to have ADHD. You've had it from when you were a kid. You just got diagnosed with it is because your symptoms got so severe now that they were impairing some sort of life, some aspect of your life. But it's a neurodevelopmental neurodevelopmental.
Yeah, I hate the word disorder.
I don't want to call it disease,
yeah,
also, but it's something that just the brains don't develop the same as and it's called neurodivergence. It's part of neurodivergence, but it affects attention.
Can we just clarify for everyone what neurodivergence means?
Yes, it means that you deviate from what social, like normal society calls like brain, and that falls under a wide umbrella of ADHD. I think autism is part of it, but you know more about it than I do. Can you have a better definition?
Sure. So I just like to think as neurodivergence is that everyone's mind operates a little differently. Right. Mm-hmm. And there's been times where there's been a lot of stigma for someone that has ADHD. Correct. Right. And when we use the term neurodivergence, we're sort of just saying minds are different, and different doesn't mean less than. Right. Correct. And that's what when we use that term, we're really trying to help re-educate people that just because somebody's mind may operate a little bit different than yours, that doesn't mean it's less than. It's just different.
Correct. I think our society is very critical and very about productivity.
Yes, I was
and
just thinking
it's just overwhelming, especially for someone with ADHD, that our minds are wired sometimes to pay attention to every little detail, and that could be overwhelming. And but it's okay. It's not a bad thing. It's just understanding how you work and how you can manage those things. And cannabis is one of those tools that is a wonderful tool that can help. And we're here to remove that stigma that it makes you lazy or it makes your ADHD worse or whatever. Yes, there are certain strains that would worsen symptoms, but we're here to remove that stigma that you can use it as one of those tools. For it.
Absolutely.
Some people like to use pharmaceutical medicine works actually really well. There was a study that it works better on men than women. I actually read that study. Anyways, we'll get more details about that. But pharmaceutical medicine works for people. Cannabis can be used as an adjunct, or some people don't choose to use pharmaceuticals and want to just use cannabis. But we'll talk about all of that and how, cannabis. But in our daily life, we talk about ADHD and stuff, but how does ADHD manifest for you, for instance, in your life? Or tell me your experience, Michal. What was your experience with ADHD?
That is such a huge question. So where do I start? I'll just say, how does it for me, I didn't have awareness that I had it until I was getting my master's at Columbia University, and I was really struggling with some of the tasks that I had to do, that a lot of things that involved note taking, right? And I learned about it in a course, and I was like, this explains me, right? And it was, I'm someone that really struggled with organization, right? When it was time to write a paper, my brain would not start working on it until the night before, right? Procrastination. And another way that I really have noticed it in my life. So I kind of self-diagnosed going to grad school, and then it was affirmed when I tried a medicine, and I seemed to be a lot calmer and was able to organize things more easily. But some of the ways that it affects me, impulsivity, right? Which I'll get to later. Cannabis can really help slow down, but sometimes cannabis could also enhance impulsivity, right? And one thing that we're going to talk about is it's never a one-size-fits-all approach with cannabis and ADHD. Some
ADHD sidetrack story about cannabis worsening your ADHD. Go. Neurodivergent. Go ahead. You shared that with me earlier.
Oh, about my dog? Okay, so here's a story about impulsivity. 16 years ago, I was visiting Venice Beach, California, and I was high because at that time it was, and I had always wanted a dog, but I never felt like I was in the right place exactly. But when I was high and these guys were selling little puppies, and when I held this little baby chihuahua, magic. Yes, and there is not the best reaction from family and friends that I bought a dog on vacation. But that was an example that there was some impulsivity.
You were on vacation.
I was on
Holy
vacation.
shit. I thought that you lived there.
I was on vacation. And people were like, who buys a dog when they're on vacation?
Michal apparently buys a dog when she's on vacation.
And a lot of times we'll look down at impulsivity, right, in the medical field, like this is bad thing. And sometimes there can be big consequences, right? But I'll just say that impulsive decision was one of it turned out to be the love of my life, my little dog. So, it just depends on the context when we're looking at impulsivity. But for sure, for me, my ADHD has caused before I had awareness of how to understand impulsivity and work with it, there was a lot of decisions that came from impulsivity.
Same. I agree with you. For me, it would present itself as I would interrupt people. Like right now, I was just sitting with myself. I mean, I already interrupted you once, but I was just sitting with myself, just telling myself, listen, just be present and all that. And cannabis is one of those tools that helps you to be like, okay, I'm just gonna, and actually focus on what you're talking. But that's what it presents for me, is just like, I want to, sometimes talk over, or for me, it was like doing fast decisions before reaching, having full information, like present in front of me, and add that, a little bit of anger. And another aspect of ADHD is emotional dysregulation. We don't talk about that too.
Oh, yeah. I'd love to hear just kind of your thoughts on that, and any personal stories about
that's when cannabis is really helpful with people who have emotional bursts of, anger. And I think it also, when it comes to ADHD, unfortunately, ADHD, especially if you're like an adult, it's just ADHD comes wrapped with a little bit of like a layer of anxiety and a layer of depression. And it's just those, I think, come just from situations and how the society you had to deal with, being traumatized with society as someone you just didn't fit in, whether at work or whether at school, or you were labeled weird, or, just, I was bullied at school, actually, because I just had these like little interests. I like to make little things. I was bullied at school, and I was a little kid, but that just traumatized me not to speak up my mind or all that. And as an adult, I just would have emotional dysregulation, where I would just have bursts of just anger, just
outbursts over just little things, and you're like, my relationships suffered. Sorry, all ex-girlfriends. And and but that was also, I was not aware of those things that and then you introduce cannabis into all of that, and it's just like helps you, like tells your anxiety like, hey, just take a step back, sit back, hey, let me just, and then your compassionate self comes in, and it's just like, yo, come on, child, you've been lost, let me talk to you here, and it's just
so beautiful. Actually.
Helps you think like, wait a second, that's right, why did I, I mean, we're all human. It's okay also to forgive yourself, but also to be aware. And that's the other takes me to the other thing with ADHD, self-worth. It's just like a big ball of.
There's so much to untangle when we think about ADHD, because again, most people, when they hear ADHD, they think, oh, this person might procrastinate or might have a hard time with deadlines, the organizational piece, right? Or they interrupt people, right? Those things. But most of the clients that I've worked with all have struggled with thinking they're not good enough. Oh, yeah. Right? Because sometimes you get these messages from
society,
you, right? That if you're not able to do this task this way, something's wrong with you, right? And so many people with ADHD have internalized this belief that I'm not good enough. And when we think about what we're trying to heal and help with, is just because I may do something a little bit different than somebody else, that doesn't mean I'm less than. Just means I do something differently.
Or take time. Like for me, I have such anxiety about time, and I'm still, for everyone who knows me, I'm late. My friends used to say I'm going to be late for my own funeral, but
time blindness is another huge symptom with ADHD.
Even though I've planned it, and I know, but if I know I have an appointment, or I have, like today, for today's podcast, my goodness, I was anxious, and I was just calming myself, and just, my little friend, the dab rig, was very helpful in calming that anxiety and just telling me, yeah, hey, it's just friends coming over for you to talk. And we're just really just talking. But
I was anxious too. I'm still a little anxious, right? Just because
we're not used to it.
We're not used to it.
Yeah. So be gentle with us. Just be very gentle. Anyways, but just you like, see, I lost my train of thoughts. That's another thing with ADHD is one thought comes in, my RAM is very limited. It's just the memory, the short-term memory, and that's also, I want to just dabble into that. It's not something because I'm lazy or, like my forgetfulness is literally just how my brain is wired. And scientifically speaking, what research have shown, like they've done, like CT scans and like from children with ADHD and children that weren't diagnosed with ADHD or even adults. And they found that just how ADHD affects an area in your brain called the prefrontal lobe, which is your command center of your brain. It's, what tells you like, hey, this is important. You got to do this. And if you don't do this, you have consequences. Some shit happens out there. We don't know what causes it, but people's brains with ADHD, some shit just is not there. And another thing is there's a dysfunction in the reward center, meaning, how some people have, if I do this, if I, like do my homework first, then I can watch cartoons just for kids. Or for instance, if I'm an adult, like for instance, me, I need to finish all my notes, for my patients so I can get paid or do something. And it's just, I don't find that task interesting. It's just boring for me, but it's just, I delay it and I procrastinate about it. And but also like, it's
can I interrupt
yes,
you
of
for
course.
a second? Because I want to just say that this is to me, it's another big misunderstanding with ADHD is people think that it means you can't pay attention, but it's actually the opposite. it's that, like, as you're
Hyper-focus.
saying, you can't pay attention to things that you're not interested in, right? But things you're interested in, like as you shared in the beginning, you went down a rabbit hole.
Yes.
Right? And so it's such a misnomer to even have it be named attention deficit disorder, because it ignores that there can be lots of attention to things that mean something and are interesting to us.
You
right?
know,
and we don't have to think of ourselves as less than if we don't enjoy writing notes.
Exactly. Like the way I think of ADHD is like a jack of all trades. Like I have so many interests that my brain just goes into, and some people be like, I don't care, but for me, it's just like, oh my God, that's like, how can people, like, I just like to observe the world around me. And I think as a kid, that's why I was bullied. I would always be observant of the world. Like I would sit for hours and watch ants, as a kid, we couldn't leave the home because of war, but that's something different topic. But it was just like, I would self-entertain, and I wasn't, didn't get in trouble, and it was just because I would daydream, and my imagination, it was just like so many, and I would even always be thinking, like, even to this day, like, it's like so interesting to me how the world works and how things are. And even like cannabis got me into all this beautiful gardening, and it's just, I love them. They just bring so much joy to me, and I think about them, and it's so amazing how like each one of them has its own colors. Like, isn't that a fucking amazing? Like, don't you think about that? That's one of the things when I wake up, I think about that, and I'm thankful.
The diversity of plants helps us appreciate the diversity of minds.
Exactly, and it's just, but like, those are the things like my mind thinks about, like little things, versus people would be like, oh, you're lost in train of thought, or you're daydreaming or whatever. And it's just being observant about things. And if you don't nourish that in a child, especially
right, because children often get
curious,
yelled at for daydreaming, right? Or that it's like, but daydreaming is a beautiful thing.
Yes,
the imagination is so important, right? But so a lot of things are, the society doesn't give us the right model, and which then people internalize of something's wrong with me. So that again is why you will see a lot of times anxiety coexisting with ADHD.
Yeah. But there's also things that I call it the ADHD tax too, is me procrastinating and just not having. Another thing is motivation, struggle with motivation. And that takes me to the other point, the struggle with motivation, and also like delayed gratification comes from actually the dopamine system in our brain. Dopamine is one of the substances that are found in our brain, and it's responsible. People think it's just mood. No, it's responsible for your movement, actually, too. Part of your movement, regulation of blood pressure, has a lot of. But in terms of ADHD, it actually has, like helps with the feeling of satisfaction, the feeling of happiness, and all that. And people with ADHD either don't have enough receptors in their brain for that dopamine, or don't either have, their brain doesn't produce enough dopamine and stuff like that. So that's
You're
why
getting me so curious about how cannabis affects dopamine, Abby.
That's why, like, a lot of, and I'll tell you how it does. And that's why, it's just like when you find those little tasks, and people say, oh, dopamine hits. That's actually incorrect information. You're always having dopamine. It's just how your body regulates it. But it's just all those things that you do to nourish your brain and stuff, like it just actually makes you feel happy. So there's lots of different methods, and people say like the Pomodoro method sometimes works for people, or like putting a timer. None of that shit works for me, for instance. I'm like, or you were telling me how you make schedules for this. I can make a fucking 100 schedule for myself. If I'm not, like, I'm not gonna do it. I'm like last minute kind of thing. But,
I know. I've experienced that part of you.
Yes. But, it's just living on the edge, I call it, but it's just, I'm learning now that that's where my anxiety comes from. That's where time, and I'm like, wait a second, I don't want to, like, and that's what cannabis helps me. It's just like, hey, you really want to continue living, like, and I think the universe puts like little reminders for us out there, because I see it in certain, as a geriatric nurse practitioners, I see that time anxiety reflected in certain kapuna in their behaviors. And I'm like, it's like the universe telling me, hey, if you don't change your ways, you might be, and there's nothing bad. It's just programming, but that's what I love cannabis. It just helps you with that. It's like slows things down with the ADHD mind, that time, and it tells you, brings that compassionate self about your self-worth.
Yes.
And it's just looks at just things in a more logical way. That's how I feel like it helps with cannabis. But what are some of the things that you do that helps you manage your ADHD? Or do you mind sharing if you are on medicine, or share your experience with ADHD, or how you manage it, if you don't mind?
Sure. Like, that's a great question. When I was first diagnosed in my 20s, and probably for the next 10 to 12 years or so, I was on and off taking stimulants. Mm-hmm. And they did have a big benefit for me, because some of my jobs, I worked in a inpatient psychiatric unit at a hospital. Mm-hmm. And you as a social worker, you had to be so organized with making referrals, knowing all the things in the community, and it was just a very overwhelming job, because you had the patients wanting to talk to you. Mm-hmm. You had family members calling you as a point of contact. You're having to, so it was being on a stimulant really helped me with focus and organization, that I didn't necessarily have those skills on my own. But I would say that the more that I started to live my life in alignment with what I really wanted to do, mm-hmm. and that I'm passionate about. Mm-hmm. Like, now I have my own therapy practice, and I love working for myself. I have not taken a stimulant in a long time. I intentionally went off of them probably maybe 8 or 9 years ago.
Nice. Do you notice like a difference in like right after you stopped them? Did you notice a difference? Or I know now like you're managing obviously 9 years later, but immediately after you stopped, did you notice like a drastic change?
I don't remember. But I mean, what stands out the most is that I
must have not been bad if you don't remember.
I was missing the stimulants. I had no appetite on, and mm-hmm. I felt excited to have my appetite come back. That's what I remember.
That's one thing. Honestly, my experience is I got diagnosed at age 41.
Can I ask what led? Like, how did that happen?
Actually, I was in a relationship, and for the first time, that person, I felt safe to discuss, how I felt or whatever, and they were like, they had a little bit more awareness than I did, a lot more about, how, of course it takes someone, and I was just also, I was transitioning from a job, and every job or in my career, everywhere I've worked, I worked at MD Anderson oncology. My background is also oncology. Cancer patients have a special place in my heart. But I worked in these big institutions, and I just felt valued, and I loved it. And here, the culture of healthcare in Hawaii is very catty, honestly, and very cliquish. And I transitioned to a job, and I wasn't part of the clique, and I was, believe it or not, bullied at that job. And it just caused me to question myself and all that. And I was like, maybe I need to get on stimulants and all that. And then I went and I saw Dr. Cook, actually. And just to let you know, just the diagnosis for ADHD, it's not like it's really just clinical presentation. And like I said, even though I was diagnosed at age 40, I didn't, didn't really start affect me until the symptoms, until like later in life. But I also have other history of trauma too, so it's just kind of like
hard to separate.
It's like I just
what's causing what.
It's just like I just hadn't, let me put it that way, I hadn't addressed my mental health. And I think just part of it is coming to Hawaii. My whole life, it felt like I've been in survival mode. I came to this life in war times, and it was always survival for me. So there's that trauma behind it. And when I came to Hawaii, I found peace. So it's just, so I call Hawaii home. And it's just that, I don't know, I lost my train, but it's just that peace that I have, I think, made me start reflecting back on myself and thinking like, hey, you know, maybe, and cannabis had honestly introduced me, like they say cannabis is a gateway drug. Yes, I'll tell you this. Number one, I don't call it a drug. It's medicine. And it's a plant. Number two, cannabis is a gateway medicine to self-care, to loving yourself, to gardening, you know, to taking care of yourself, to taking care of your body, taking care of your community. So, you know, I didn't used to believe, you know, when patients, like, I didn't used to believe, but I used to be dismissive of when patients would tell me like, you know, the government, you know, like doesn't want cannabis because it really instills peace in people. You know, that's my thing.
In using cannabis for my own self, right? It definitely has helped me on my journey of self-love, right? And
but just
peace, right? That ability to feel peace within yourself.
Exactly. It's just, you know, it just helps you peel those layers of your psyche, of yourself, and without judgment. And I'll go, you know, like one thing with cannabis. So I've tried cannabis when I was young, and it triggered anxiety in me. And that was something I just, you know, but through therapy and through self-reflection and meditation, it just led me to face that anxiety and I understood why when I used cannabis, I was anxious, because I had so many layers of myself put out, you know, like imposter syndrome. That's another thing with people with ADHD. You put so many layers to present yourself to the world that you forget who you are, you know, and all you are truly is just a,
right,
if you
masking.
peel, if I peel,
so
yes,
masking.
if I peel off all those layers, all I was is just a traumatized kid that wanted love. And cannabis gave me that love, and it opened the whole world for me, you know. I tried stimulants. Stimulants gave me more anxiety, did not help me focus. I lost weight. I couldn't afford to lose weight. I couldn't sleep, you know, and I was on one of the lowest dosages. And I also have another disease that affects my blood vessels that taking stimulants worsened that condition. So I went back to Dr. Cook and I said, I cannot do this. I was like, it's just, I'd rather just manage those symptoms with therapy and stuff than take stimulants. And he was fine, but he also brought it to my attention that, you know, like he diagnosed me with depression too, as well, anxiety and all that. And I'm so thankful because he put me on a different medicine called Wellbutrin, which is an antidepressant. But Wellbutrin works really well with people with ADHD. Like stimulants, just to go back, what stimulants do for you, the medicine, it helps with that impulsivity part. So that's the part that stimulants help with. But they also have side effects. And in medicine, you always weigh the risk versus the benefit. So for someone like you, stimulants helped you and worked well for you until you were able to manage on your own. And that's exactly the goal that they were supposed to be. Some people can stay on them for the rest of their life, but that's when you start aging and you start having heart problems and stuff. You can't be on stimulants. So
right. And I think you're just speaking to like such an important point right now that, and this goes for cannabis too, no two people are always going to have the same experience. And so we can never just say, we can never say, oh, if you have ADHD, use cannabis.
No.
It can make some people's ADHD worse, and other people it can enhance it and help it, right? But it's so different for each person, which also most psychiatric medications are different for each person.
Correct.
Right? So it's one area of medicine where it's not just like you take this and it's going to do this. It's very much a trial and error.
Psychiatric medicine, by the way, is all trial and error. Literally, you put people on I'm not a psychiatric professional, but we'll be getting some people on this show. But it's just like you put them standards. We have guidelines that say you start with this first medicine. If this person doesn't work for them, you can start with this other one, and then that's through trials. It's not like we pull this out of our asses. It's through recommendations and trials and how these medicines have been tested and all that. But which also brings me to cannabis research. Anyone who smoked cannabis knows that cannabis elevates your mood, or sometimes can exacerbate anxiety, like it used to do for me. But then I recognize that we also have a society that wants to suppress every emotion, right, rather than process it. So suppress it in a time if it feels overwhelming, but later on processes it, and that's cannabis comes in. But it's, I do find medicine helpful for some people, but it's not just the only thing. It's just a lot of modalities. What worked best for me literally is just meditation, plant medicine, and just therapy. And I'm so lucky that I was blessed with a therapist that had no judgment against plant medicine, someone like you, that I felt safe, because it's a stigma for a healthcare provider too, is and part of it is I work for myself because I don't want to answer to anyone, and God forbid your doctor uses cannabis or your nurse, your provider uses cannabis. They're crazy, right? But
well, it's interesting that you say that, because I have been judged by certain therapists when I opened up about using cannabis, and others. I did a lot of psychoanalytic training in my career, and my analyst never judged me. So always grateful to him, because then I could even go high to my sessions, right? Because the thing is too, in my own healing journey, to be in an altered state made it easier for me to share things.
Now let me ask you this: do you allow your patients to utilize cannabis in sessions?
I do.
Yes.
I do.
Yes. You heard that, guys? She's available on HMSA Online Care. Well, we'll leave our information after but cannabis friendly healthcare, mental health care provider here.
It's very important to me to not ever judge anybody, because I know what it feels like to be judged as a client, as a patient, right? And that's such a horrible feeling when you're going to a provider, opening up about really personal things, and you share that thing and you're met with judgment. And then when in my younger days, I internalized that judgment, right? But because we always have to a big part of therapy is to understand what we've been conditioned to believe, and then to be able to notice, well, do I really agree with that conditioning, right? And that's where, again, it's like the war on drugs has really done a lot of damage in conditioning people to think, right, reefer madness, right? You use this, and this is how you're going to be. And that's why, again, why I'm so excited to be doing this podcast, because we are the voices to say, actually, cannabis is a neuroprotectant.
Oh, yeah. We're going to be doing a whole bunch of, I'm going to be bringing you, we're going to be talking about research and stuff, and how can cannabis, legitimate research, but there's also cannabis research gets suppressed too. That's another thing. But that's a whole new different topic. But there's, even with cannabis use, I want to address the other thing, like the side effects that can have from cannabis. So cannabis, besides helping you with being present, we'll talk about that a little bit in details,
Yeah, I definitely want to make sure we come back
Yes.
to mindfulness and cannabis.
But for people with ADHD, it's helpful for that appetite, like to help you eat. ADHD by itself, I personally am not on any stimulants, but I literally forget to eat sometimes. Or
I wish I had that problem, Abby.
My mind doesn't, like my family literally has to fucking hand me food in my office because I'm so hyper focused on working or like sitting, like, because I work telehealth, and like literally they're like, hey, it's 3:00, you haven't eaten yet, and I've been up since 6 or 7. So it's just, although I feel the pain, so cannabis, just be careful, because certain cannabis can, block your appetite, and there are certain strains that can stimulate your appetite. So find the one that can help you, but also.
Wait, can I ask you a question?
Sure.
So if someone is coming to you for their card, do you talk to them about dosing?
Of
and
course. That's
can you share a little bit about that, Abby?
Yes. So when someone, for instance, comes to me with ADHD, because I understand what ADHD is, and I understand how cannabis is. Cannabis can work as, you could either use it to escape and avoid the stuff, or you could use it as, to help you focus. And besides the strain, it depends on the strain. It also depends on the dosage. So regardless of a certain strain is an upper or whatever, use the wrong term, sativa. We'll talk. There's more educational stuff coming. But it's, like regardless if it's a stimulant, if you consume enough of it, it's going to take away your attention and all that, because it's cannabis. Besides the, effect of it, it can be also dose dependent, The other thing with people with ADHD, like I said, our brain is wired differently, and our gratification, is different. So you're always wanting to feel happy and feel high and all that. And that's okay. That's when we talk about cannabis use disorder. So I talk to them about that. Hey, you are at a higher, this is another study that people with ADHD have a higher risk for substance abuse disorder. And it's, also kind of people with PTSD, the same thing. I have the conversation with them that it's not about the amount of how much you're using cannabis, because everyone is different in their usage and their tolerance and how your body metabolizes it. And there is, a form that I use, a legitimate form that I use with patients when I follow up. But I do have that talk with them that, you're more higher risk. So always monitor. And how do you recognize it in your life? Is cannabis your cannabis use like any other substance? Is it impairing your life? Is it impairing your work? Is it impairing your relationships? Is it, causing harm, or, not harm, but just causing disruption in your life more than? And then also look back. It's not cannabis, it's your relationship with cannabis,
Exactly. Yeah,
and that's maybe,
relationship.
that's when I talk to them, or a lot of patients come and say, I use it to help me sleep or to help me focus or whatever. Or I always, if I see there's someone, I always ask them, do they have a therapist too? If they have a therapist, or how to mitigate, like people sometimes say, I just use smoking to help me sleep. And I'm like, tell them, no, try edibles. Edibles is better. Edibles are technically better for you if you're utilizing it for sleep, longer duration. So I always educate my patients about use. Just because cannabis, the legality of cannabis in certain states or whatever, it's still medicine, and there is ways of using it. And when people say the recreational use, to me, cannabis medicine is always therapeutic. Even the recreational part we call, you're using it to elevate your mood, and fuck, man, it's enough with the talk about, I don't want to get high, or whatever.
And it's so important.
It's
like
fun to get high.
It's fun, and it's great to elevate your mood.
Just
right? Like,
use it responsibly. Just shit, man. Let's get enough with that stigma of like people, and I'm addressing this also to any healthcare professional. If you want me to talk to you about how cannabis can help your patients or have that talk, please, let's collaborate, because there's also, I want to remove that stigma between, and if you don't want to talk to me, there's lots of courses online that you can read, but don't deny your patients cannabis. If you don't, send them to a specialist, someone like me, or just don't deny your patients or dismiss it or just judge them because cannabis use. Just educate yourself and remove that stigma about it. It's not a drug, it's a medicine. That's just, this is what just bothers me sometimes in healthcare, is like I see old school doctors just very dismissive or tell their patients they shouldn't be using cannabis. But just cannabis can not just, even with ADHD, it has so many different, it helps with so many different other things, but we got to focus back on.
But I will just say, right, speaking to just this, I had a psychiatrist when I was living in New York City who was open to prescribing me Marinol, which is
synthetic. It's a pharmaceutical synthetic. But we'll talk about that.
And I had a great experience with that. And I remember when I moved here and I had met with a new psychiatrist and I showed him, this is what I've been taking. Don't expect me to prescribe that for you.
Judgment.
That total judgment, right? And I mean, maybe my psychiatrist in New York was Indian, so maybe he was more open because there is some cultural. But you just never know with your healthcare provider, and we really want to change that.
But I also want people to be honest with their healthcare provider, especially if you have other conditions, like we're going to be discussing all that, but like people with high blood pressure, people with cardiac issues, cannabis can have some side effects. So you have to be, it's the same as stimulants when someone gives you the stimulants. But so ADHD can address a lot of those, but you have to be mindful of cannabis use disorder, and whomever certified you, or if you have a card, or talk to your healthcare provider if you feel that you're questioning your use or anything. That's a conversation. It should happen with your doctor. You shouldn't feel afraid to talking to your healthcare provider, your nurse practitioner, physician assistant, or a doctor, your PCP, because after all, it's your body. Why should you be hiding, and if your healthcare provider is not on par with what you're using, it's your body. It's not them.
Let me just say, Dr. Carl Hart is a dear friend of mine, and he looks at, any drug use is your human right? Bodily autonomy. Each person should have their own right of what they're putting in and out of their body.
Oh, well, that's also the very interesting topic, because that's when you start drawing where the line between starting actions affecting society and all that. But that's
another topic. Yeah,
this
is both of our ADHDs. We can just I think, to me, actually, I just want to say, I look at ADHD because it can be like both curse and blessing. Right? When I
don't like the term. I don't like those terms either.
Challenge and gifts. Challenge, I think everybody has strengths and weaknesses.
See, I feel you're still looking at it from a negative connotation. I think it has you're looking at it from the lens of normal people. As someone with ADHD, it's just my way of life. It's just but just because it doesn't fit your own way of life,
I agree,
doesn't make me less of you. And just because I need more time with stuff to accommodate for it. And that's why, with ADHD, also an important aspect, pick your career wisely. With part of ADHD is movement. Movement is very important,
Yeah. Because something you just said, now I lost my thought, but picking your career wisely, because what I'll see a lot of times with my clients, they are not in the right environment, right? But they'll think, what's wrong with me that I can't do this job? And a lot of times it's helping people see there's nothing wrong with you. It's the environment, right? But I like what you were saying. You're right. I shouldn't even frame it in that way. But I did just want to say, right, the ability to go to different topics, that's a gift, because that's creativity right there.
It is. And, coming back, same thing. I honestly work for myself, and, it's business owner, I feel you. You know, it's but
There's always something to do. Right?
but yes, your life is never your work is never done. But at the same time, I'm working for myself, and I'm not in a working for a bureaucratic, you know, like institution that tells me I have to put patients in a, you know, like I like to talk story with patients, and some patients it's just you talk to them and you get their needs, and some patients you just have that connection with them, especially like I'm a geriatric kapuna. I love talking to, you know, and they have the best stories and stuff. So I can't tell them, oh, sorry, auntie, sorry, uncle, 30 minutes are up, you know. I'm like, and this is the thing with ADHD. Time blindness, like we said. But anyways, that's where intentional use of cannabis, when you use it intentionally and you use it to, like I said, if you are having a crisis and you utilize, let's say you're having a panic attack or anxiety or a bout of emotional dysregulation and you need cannabis to help you regulate that and bring you down, you know, from being in the red or anything, and just bring you down to help you process. That's what you got to do, is process. Cannabis helps you process that emotion when you're have the capacity to do so, and figure out also like why did you get triggered with that, and all that combined with therapy is just, I feel, is
Yeah, I mean that's kind of, you know, the cannabis in conjunction with mindfulness is so potent. And just to share for a moment what mindfulness is. Mm-hmm. Mindfulness is a term we use a lot now in healthcare, and it really is just about attention, mm-hmm. being present, right? But it's not easy for most of us, even ADHD or not ADHD, mm-hmm. it's hard for most people to be present. We're either ruminating on something that happened in the past, or we can be worried about the future, right? And what mindfulness is there's skills that help us come to the present moment, be aware. And when you pair cannabis, is a beautiful way to help people be in the present moment, because for a lot of us, it slows the mind down. And once we slow the mind down, we actually can notice what we're feeling, exactly. Right? And without judgment, right? And then the cannabis helps us hold everything that we're noticing with compassion, mm-hmm. and tenderness, mm-hmm. right? And so it's to me, it can be a very soft experience.
But I'll tell you this, you know, when I used cannabis before therapy, that wasn't my experience. Like I said, it would trigger that anxiety, and I didn't know how to deal with that anxiety. But when I combined it with therapy, and therapy is really, it's not about hashing out the past, by the way people think, you know, for people who have PTSD. It's actually just learning how to manage to deal with your emotions that come from those, you know. And it's just with therapy helped me understand like how to, you know, like manage those feelings and stuff, and just it opens your eyes to your own psyche. It's that's what it helps you be present. And you look at, like, when you like utilize cannabis and you're like, holy shit, look at this little like fucking flower growing on that. It's just,
it like brings that like wonder of a child,
yes,
right back.
Yes,
right?
Yes. And so fucking normalize feeling high and being happy, guys. You know, it's okay. But again, it has its place and time. You know, use it responsibly.
Yes.
And we got to get out of that. Yes, the stoner mentality, of course, we all like the culture and all that. But cannabis is not just about stoner mentality. It's truly just when you use it with intention, and it's just has such a like therapeutic just benefit, even for your body. Like just it makes you more aware of your body. I was talking with Calais the other day, who used to say he would just smoke like a certain strain that would make him more aware of his muscles, which muscles to stretch, which muscles to, you know, like, so it's also helps
I
you
don't
with
know if you
exercise.
noticed, I'm a certified ganja yoga instructor.
Oh.
So because when you pair
The multi-talented Michal.
when you pair cannabis with it's very gentle yoga, it's exactly that. You really feel like that stretch, and you're doing it very mindfully. It's such a beautiful experience.
Yes, and you know what? Like, one of the tricks also with cannabis with ADHD and cannabis is that boring task that you don't want to do something fun. Like, your dose and your tolerance. Utilize cannabis if it helps you with focus. And like, for instance, when I don't want to do something, and I'm like feeling like my mood is just like, oh, like shit, I dance. I put on some good music there are some music. And sometimes it's just music, like, which leads me to a different subject with ADHD, but we're running out of time.
We are running out of time, so we got to make sure.
But it's just combine that boring task with something fun, or motivate yourself with a little bit of that, with the gratification, with just a little bit of a gratification, but it just puts your mood, elevates you, and like, let me go do that task. And break it down, literally, and prepare, prepare your day. If you're someone, consistency is key, so prepare your day. Those are things you can manage your ADHD without medicine, just by behavioral things.
Exactly. There's so many different behavioral things that we can do to help manage ADHD. And then there's also, like for me personally, I really don't enjoy cleaning, but if I get a little high, I have that, I can do it. It makes me more interested in what I'm going to do. So,
but don't you feel so happy when your house is clean after, and you're like,
yeah,
that motivates me. Like, the after, like, it's just like, and sometimes it's such a minute task. So another trick that I do, I tell myself, if it takes me less than 2 minutes to do it, don't procrastinate. Do it right then and there.
I do that same thing, especially with emails and texts, because if I don't respond right away, sometimes it just goes way to the, you know what I mean? And if I can do it short and sweet, like, do it right then and there. Well, I know we are coming to the end of our time.
We could talk forever about ADHD.
Forever.
So this is because of that, actually. This is just, consider this as episode number 1 of ADHD specifically. We're going to talk a whole bunch of episodes about ADHD. But we unfortunately have to limit our discussions about it. So, sorry, didn't mean to interrupt you. ADHD moment.
It's just been so much fun to share this with you, Abby. And I just want everyone to know, we'd love to hear questions from you. Yeah. And if you're enjoying this podcast, like us, follow us, subscribe.
Give us ideas, whatever you wanna. We're just starting us blabbering at each other, just letting our creativity flow with ADHD, and so if you have a certain topic or you want to talk, put it in the comments. We'd love to hear from you. And which brings me to our next episode is actually going to be talking about cannabis and cancer. It's an important subject, but those are some of the topics we're going to be discussing. So we appreciate you for listening to us. And we like to end, you decided to end our, with gratitude. But I also wanted to, what is your reflection on ADHD before, we go to that at the end?
So interestingly enough, I will just say I didn't even get to share a lot of my thinking on ADHD has been informed by my teacher, Dr. Gabor Maté. And this book, Scattered Minds, is a great way for anybody that has ADHD to understand yourself. And so I just wanted to share that in closing because, ADHD moment, I forgot to mention this earlier. But you know what? I'm okay that I forget things sometimes. Mm-hmm. I'm okay with that.
We're all human.
So what would you like to share in closing?
I want to share that just because society labels you as something that's not the truth about you. So just really, truly meditate and look into that self of yours that you've been ignoring for a long time, and talk to them and see what's going on, and or just sit in silence or whatever, or go fucking do something you enjoy, but just take your mind off of you needing to be anything for anyone.
I love that, Abby. I love that.
Take care of yourself.
That's
At
so
least,
powerful.
if you can do it for one day, for not one day, for an hour, for 5 minutes, 10 breaths. But, and it's, ADHD actually is taught me to be more attentive. And I wanted to also bring that a lot of those creative people that we think about in the Aristotle and all, like Michelangelo, who was a jack of all fucking trade, had ADHD probably. Okay. Anyways, but that's my reflection about ADHD. And like I said, please share, and follow us. We're doing this because we really want to spread, the knowledge about cannabis and remove the stigma from using it. So you doing so helps us spread that word. And I want to end our first episode of our podcast with what are you grateful for today?
I'm really grateful for knowing you and doing this experience with you.
I love you, Michal.
I love you too.
Me too. I'm so grateful and for knowing you too, my dear, and for just this today, like I said, and I'm just grateful for the situation and the people, the person behind everything right there, Mr. Eric.
Thank you so much
for
Thank you so
putting
much,
this
Eric.
together. And my heart is full. And stay tuned for episode 2, because you can understand what brought us together is actually in episode number 2. Aloha, and thank you for listening.
Thank you.